Hi everyone, hope you've been staying safe and healthy, and thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and your hometown with your question. I'll pick a few questions each week to discuss in the vlog. The trajectory here in the Northeast and in most parts of the country remains favorable. Only a small minority of states still have rising cases. Cases are still high, but as a society, we're building immunity. There's a lot of talk about getting back to normal and when it's okay to do that. The problem is there's no right or wrong answer to that question. Policy, whether it's about masks in school or vaccine passports to enter a restaurant, are not based only on science, but on a combination of science and values. One person might value prevention of infection more than another, or might see the benefits of normalcy on mental health as more important than another. Ultimately, it falls on politicians and other leaders to take the science and the values of their communities and make policy. That's why we have more normalcy in some parts of this country than others. That's also why we have more normalcy for adults than we do school children and college students. This week, Massachusetts cabinet members, Secretary Pizer of Education and Secretary Sutters of Health and Human Services, released a letter addressed to public and private higher education presidents, meaning college and university leaders. These are two people who have dedicated their careers to education and health, respectively. Think about that as you read a few quotes from the letter. Together, our goal must now be to transition the COVID-19 pandemic into an endemic, a highly contagious virus that is manageable and allows us to regain a sense of normalcy. The twindemic is COVID and social isolation. Higher education has the opportunity to lead. Colleges and universities should accelerate their efforts to transition back to near normal conditions. They specifically list remote learning, restricting group activities, overly aggressive surveillance testing, and mask-type requirements as things that need to be phased out. I'm sure they're getting a lot of pushback, but I think this demonstrates incredible leadership. Our first question is from Sandra from New York City. Last year, I learned that getting vaccinated after a COVID infection creates superimmunity. And now they're saying that a breakthrough infection after vaccination and a booster shot will provide superimmunity. That does not make any sense to me. Are they trying to make folks feel better for getting COVID despite being triple vaccinated? Also, do we know which vaccine had more breakthrough infections? Well, the good news is that vaccines are holding up against severe disease, and the booster really solidifies that protection, even when it comes to Omicron, which evades protection from the vaccine. The less good news is that vaccines don't protect against any infection like they did in the early days, both because variants seem able to emerge that evade that protection, and because the protection against any infection in your nose fades pretty quickly. So we need to shift our expectations of what we want the vaccine to do for us. It is keeping us alive and out of the hospital. At the same time, work is being done to develop vaccines, if possible, that might actually prevent any infection. If you're triple vaccinated and you get Omicron, the chance of something really bad happening to you are tiny. And once you recover, you do have this hybrid immunity. You're protected against any infection by Omicron and variants similar to Omicron, while you're still protected against severe disease from other variants in the future. To your last question, it appears that Moderna has the strongest protection against any infection, followed by Pfizer, followed by J&J, but all protect well against severe disease. Our second question comes from Roberta from Washington, D.C. I saw your op-ed in the Washington Post supporting a move to optional masking in schools. What do you think the timeline should be for this shift, given that the Omicron surge is not yet over and COVID is more prevalent in some areas than others? Well, You know, masks are already optional in schools in many parts of this country and many countries in the world. And as I said in the introduction today, the right time for you might be very different from the right time for me, and I really respect that. So I think now, as cases are on the decline, is when we need to be talking, specifically educating, providing positive, factual messaging on the low risk of COVID to children and to vaccinated adults, doing everything possible to vaccinate those who are not yet vaccinated, teaching people that they don't need everyone around them to wear a mask if they choose to wear a high-quality protective one themselves, preparing school communities for a shift to treating this virus like all of the others we live with all the time. In a few weeks, when cases are lower, I would like to see the prioritization of normalcy for children. Our last question is from Maurice from Ipswich. I've been reading about the Omicron subvariant, which appears to be 50% more contagious than Omicron. Should we be concerned about this? Does it have the potential to extend the Omicron surge? Maurice, the subvariant you're referring to is called BA2, and it's actually been around for a while, like 2 months, which is a good thing because it means it hasn't just emerged and quickly taken over. It appears to be somewhat more contagious, so it bears watching. But it's not a cause for panic. I think it has the potential to extend the current surge. Worst case scenario, 2 peaks, with the second one coming down fast, like we've seen with Omicron so far. But more likely, we just see a less steep decline. Best case scenario, it doesn't affect the curves in the US at all. We will have to wait and see. That's all the time we have for this week. You can send me your questions about the Omicron surge, booster shots, COVID testing, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason for you again next week.